Hello, everyone. My name is Sarah Clayton, and I'm one of the managers in the Office of Patient Experience. And I'm thrilled to be here today to talk with you about patient engagement and how we can help patients feel more connected and involved and empowered in their care. We'll be together for about an hour, maybe a little bit less. We're going to talk about some best practices, some of those tools that are going to improve your communication and connection with patients, especially at the bedside. We're going to talk about how important it is to connect patients with that quality and safety component of their care. And really, we're going to dig in a little bit to the survey component. This is how we measure how well we're doing and how we receive that information from our patients and their perspective, and how it impacts us in our work as well. So what is patient experience? I think this is something that we don't often take the opportunity to dig into. It's kind of a buzzword that we hear about frequently, right? We always want to be patient focused and patient centered. But what does that look like? What does that really look like in our practice? How do we make sure that our patients feel like we're putting them first? And so I'm going to share with you all a definition that we sort of created with our patient and family advisory councils. So these are former patients, family members of former patients. They come back and they tell us things that we do really well and things that we could maybe do to improve some of our work. So this was something that we workshopped with them, and this is what they came up with. Patient experience is respect and compassion with every patient from every healthcare team member in every interaction. It is safe, authentic treatment with individualized goals that empowers and partners with patients, families, and caregivers in all discussions and decisions. I love this definition because I think it is so all-encompassing in everything that we talk about within that patient experience realm. What is really important to remember in here is that we're talking about respect and compassion with every patient from every healthcare team member in all interactions. So this means that as folks who work with patients at the bedside, yes, we want to be focusing on our patients, but we have to remember that our reach goes far beyond that as well. Anytime we set foot on campus, anytime we're within this facility, we're going to be walking past, we're going to be interacting with someone's patient, someone's family member. And so we want to make sure that we are presenting ourselves with that high level of professionalism and attention that we would give our patients at the bedside just anywhere we are throughout the enterprise. So I think that's such an important thing for us to touch on and remember. And then also want to talk about that individualized goals that empowers and partners. So we want to make sure, and we're going to talk about this a little bit more later on, but that individualized patient care, we're paying attention to our patient as a person and not just another number, not just another task that we have to complete in our day. So our patients can really tell. I think that word in there, authentic, matters because our patients want to connect with us. They want to feel like we genuinely care about them. And we can only do that through genuine and authentic interactions. So just wanted to touch on those specific pieces of this definition, but put this out there as the platform. This is what we're going to be coming from, standing on throughout the rest of our time today, and really all the work that we're doing here at UK Healthcare. So I want to pivot just a little bit and think about it from our perspectives if we were a patient. So if you're a patient, you're coming in for care today at UK Healthcare, what would you expect as far as the care that you would receive? And we've gone ahead and created sort of buckets or categories for us to start thinking about because it's a big question, right? So in terms of quality, what would I expect as far as what does quality care look like to me? What does safe care look like to me if I'm the patient or if my loved one is the patient? I feel like I'm a lot more critical when I'm worried about the care of my loved one than I am about the care of myself. So thinking about it from those perspectives, thinking about the culture, the environment that myself or my loved one's going to be in. What is that environment? What do I want that to look like? What do I want that to feel like? So I just want to take a moment So think about that. I'll give you guys just a few seconds to kind of process that question. What would that care look like as a patient? Or what would you want it to look like? I think something that's really important to recognize is that while a lot of us might have the same answers to this question, it is different for everyone. And so we asked our advisors to share their thoughts with us on this. And these were some of the things that some of the answers that they gave us. One is in that culture piece, that caring employees. This is so important because this has to do with the patient feeling like we are not just here because it's our job. We're here because of something bigger than that and broader than that. We really care about the people that we're taking care of and about the work that we do. So if I am showing up frustrated or tired or rushed, then that perception of being a caring employee starts to decrease from that patient's perspective. So that's a big one. And also because I think the connection that we build with our patients, they are not going to trust us when we're giving them some tips on managing their pain, or they're not even going to be able to hear us. They're not going to trust us with a diagnosis or cure. In order to build that, we have to start with that culture and that caring component. So we also have a diagnosis and a cure. Our patients typically are coming to us because something's wrong and they want us to help them find out what that is. They want answers to their questions. So they want a diagnosis. They want an answer or a cure. We can't always provide that, but we're the #1 healthcare facility in the state of Kentucky. We have that expectation of being the place to go when there's something very seriously wrong. And so that's where we get referrals from all over the state, even outside of Kentucky. And we have patients that even come internationally to see some of our specialists. So we've worked really hard to earn that reputation, and we want to make sure we're delivering there. So talking about pain management and then privacy. So making sure that those conversations that we're having with our patients, that we're keeping our volume at an appropriate tone, that we're making sure that they feel like we want to make sure that their privacy is important and protected, not just for their sake, but it's something that matters to us as well. So we've got that sensitivity and compassion piece connected to caring employees. We're sensitive to what our patients are going through. We're trying to understand what their experience is like and see it from their eyes so that we can help them walk through that journey. And then if we've given them a diagnosis, we need to be able to explain what in the world that means, right? A lot of times in the nursing profession, that's what happens, where we're the ones that spend the most time with them. So then our patients look to us because we're building that trust, we're building that compassion, we're building that foundation of security with them. And so then they feel more comfortable coming to us with their questions. So we want to make sure that we're able to provide them that information and that education, especially in ways that they're able to understand it. So, and last but not least, this last selection of responses that we receive from our advisors is that skilled care. So they want to trust that we are the best ones to take care of them, that we're communicating with them clearly, that we're making sure that we're keeping them informed every step of the way. And then again, with that trust and support piece. So all of these things together combine to create that patient's experience. And so that's what we want to keep in mind. And I'm sure when I asked that question at the beginning, a lot of these things were probably what came to mind for you. So thinking about how one of these things, or many of these things, all of these things perhaps, are going to be on your patient's list as well. And so these are the things we have to keep in mind, making sure that as we're looking at that experience, how are we delivering all of these pieces to create that overall puzzle for our patients. And that's where we're going to get into some of those specific best practices and tools that the data tells us really does help our patients to understand that, yes, we are caring, we are communicating well, we do have that high level of skilled care. So The way that we get that information from our patients is through, or largely through, our surveying. We partner with Press Ganey, they're our vendor for patient experience surveys. It is a requirement through the Center for Medicare and Medicaid Services. So we have that federal component. It's how value-based care is implemented. So we get credit for certain answers that our patients provide on the survey. And then based on those responses, that's how we receive our reimbursements. So it has a direct effect on our operating costs. However, we want to recognize that we survey not just because of the financial component, but because we really do care how well we're doing. We're only required to survey in certain areas of the hospital, and but we survey everywhere. So we want to get as much feedback as possible, because we always want to be improving and doing better. So this is the best way, the best tool that we have to gain the largest volume of feedback. And these results impact, again, not just that operating cost piece, but our performance evaluations as well. So our annual evaluations that you'll have with your manager, a lot of times these patient experience survey goals are tied to those expectations. And so if we're not meeting those goals, then we may not receive the pay increases that we would like to have at the end of the year. So there's a direct tie to us personally. Again, though, it's not just about that. It's that overall piece of always wanting to improve. So I want to take a little bit of time to walk you through what that looks like, because you'll be hearing about these goals and these survey questions and responses from your supervisors at your huddles. I mean, hopefully this will be coming up regularly so that you're updated as far as where you stand as a unit and wherever you are throughout the year. So this is an example of what a paper survey would look like, what our patients would receive in the mail. And so I've highlighted here this overall rating of the hospital. This is where our enterprise goal lies. So we have rate the hospital goals all across our inpatient areas at Kentucky Children's Hospital, at Good Samaritan, and at Chandler. And so I want to focus on that because, again, that's going to be a metric that you hear about a lot. So I want to make sure you understand what that is and where that's coming from. And then also another domain that I think is really important for us to touch on is that you're here from nurses. So these are the questions that our patients fill out that directly relate to their nursing care. And we'll dig into that a little bit more. But I just wanted you to see it's not a huge survey. There's not a ton of questions, but that's what the paper survey would look like in the mail when our patients receive it that way. We are moving toward an electronic model. I mean, through the federal requirements, we have to have a certain number of paper surveys, but once we're meeting that requirement, we're switching over to a texting model, which hopefully will help our return rates just go up and we'll get even more feedback from patients. Okay, so looking at our enterprise goal for fiscal year 23, so we're right in that fourth quarter, we're getting in the home stretch. And you'll see at the bottom that chart that explains where our baseline was and our threshold, target, and max. So this is where we're trying to get to at least that target piece as our fiscal year 23 goal. So that's 73.1%, which, we think of that like, oh, that's pretty good, but it's only in the 61st percentile. So we always want to be striving for excellence and doing better. So this is the question that our patients are going to see and how it reads using any number from 0 to 10, where 0 is the worst hospital possible and 10 is the best hospital possible. What number would you use to rate this hospital during your stay? So 0 is the worst, 10 is the best. And then looking at that metric, we would see that we're tending to average in that 7 range. Now, these goals are set, again, based on the baseline. We don't want to set any goals that are unrealistic. But when we're looking at it through the lens of that, the CMS value-based care, we only receive credit for the 9s and the 10s. So even though it's like, well, we might be hitting target, that's great, but how can we do even better? How can we get to those 9s and 10s where that's our average rating? And you'll see that so far for fiscal year 23, fiscal year to date, we are at 73.39. So we are meeting target, which is awesome. We're doing better now than we were at this time last year. I think last year we weren't even at threshold. So we're doing better. And so one of the things that when we're looking at that overall rate the hospital as our enterprise goal, we also want to see what's driving that score. What makes our patients, what other questions on that survey will encourage, or I guess guide our patients to that 9 or 10, those highest answers in rate the hospital. And so one of the tools that we have to analyze this data is something called a key driver report. And so when we get this report, it takes all of the questions on that survey that we saw earlier. It says, so which ones really drive that rate the hospital? Meaning if a patient rates a 9 to 10 or a high score in any of these other questions, then is that driving that rate the hospital? I hope that makes sense the way I'm explaining it. So this report tells us the correlation and the ratio to that rate the hospital question. So essentially it helps us focus in on the other components of the survey that are going to make the biggest impact on improving that rate the hospital score. And what we see here is that for Chandler, we have a lot, those top questions, 3 out of the 5 top questions are nursing related. So the questions that we see under that domain, we're kind of focusing in on that right now, are during this hospital stay, how often did nurses treat you with courtesy and respect? So that's like the #1 key driver. If our patients feel like nurses treated them with courtesy and respect, then they are extremely likely to rate us a 9 to 10 on overall rate the hospital. Same thing with during this hospital stay, how often did nurses listen carefully to you? They have the option of never, sometimes, usually, or always. Well, if that patient selects always in this question, then they're far more likely to rate us as 9 to 10, best possible hospital ever. So, and then nurses explaining things in a way you can understand. How often did that happen? Again, never, sometimes, usually, or always. We only get credit for the always. That's what we're striving for. And then we also have a question about that call button. How often did you get help as soon as you wanted it? So that's another added piece to that nursing domain. And I share this with you all because not to say that like the overall rating of the hospital entirely rests on your shoulders as nurses, but at the same time, it is a huge piece of that. And so it's important for us to be able to connect to that, I think, as well, to think, so if I was a patient filling out this survey and I'm thinking about courtesy and respect, what is going to help me think, you know what? I was treated with courtesy and respect always versus usually or sometimes, right? I'm a pretty stingy survey taker. If it's always, it's got to be always for me. And so that's where we have to be really mindful about some of these communication techniques and making sure that we are being consistent. Every patient, every encounter, every time. Unfortunately, we don't have the luxury of when we're having a bad day or we've had a rough interaction to be able to take that in with the next patient or that next interaction, right? We've got to make sure that we are keeping that high level of consistency, because this is what we want our patients to be able to say, is that, yes, they listen to me always. I understood what they were talking about. They explained it really well to me every time. And so I just wanted to share this with you all. Typically, in most of our units, the nursing domain, the communication with nursing is is a unit goal. So this is an area as well where you'll get updates throughout the year as far as where we are, and as far as fiscal year to date, and those survey scores directly impact. You'll be talking about them with your patient care managers as you're moving forward with those evaluations that you'll do both mid-year and at the end of the year. So I always want to make sure that we take, I know like data and surveys, not the most interesting and fun topic to discuss, but when it comes to patient experience, it really does impact our work. And just want to make sure you've got that baseline understanding so that when you're having those conversations, you know where it's coming from. And of course, if any of you all ever have any further questions about survey or want to dig deeper, please reach out to myself or anyone on our team. We're happy to help walk you through that because it can get confusing. Okay, so now we're moving into some of these specific best practices. Let's talk about what they look like and how we can execute them effectively to be able to move that needle in those survey scores. One of them is called managing up. And so this is where I think when we first hear about it, we might think, oh, this is going up the chain of command. If I don't know something, I'm going to ask my manager and then their manager and so on. But what we're really talking about is just the way that we speak about ourselves and each other and the enterprise overall. So this is making sure that in our conversations with patients and families, especially, that we're not blaming, that we're making sure that we are talking about each other in the best light possible. And doing this decreases anxiety. It builds confidence with our patients, both with us and with the other members on our team. If I'm not as easy to jump on a complaining bandwagon about, I don't know, the patient's physician or another team that they're working with, they're actually going to trust me more. And so we're going to talk about what that looks like. And it also helps to create a good first impression. And I feel like managing up is easiest to explain through examples. So we'll look at that. One is managing up myself. So in my interaction with patients, of course, the first thing I'm going to do is introduce myself whenever I get a new patient or I'm coming in for my shift. I'm saying, good morning, Ms. Smith. My name's Sarah. I'm going to be your nurse today. I'm here to take great care of you. It might sound cheesy and it might sound basic, but that is one of the best ways that we can manage ourselves up is just to come in with a positive attitude and say that's what we're there to take great care of them. And that's our number one goal for the day. Versus I've heard this happen several times where someone might walk in and say, you know what, my name's Sarah, I'm going to be taking care of you today. This is my first time on this unit. I've never really been in this floor before. This isn't where I usually work. I'm usually over in peds. And so this is a different spot for me, but just bear with me. I'm going to do what I can to make sure you're taken care of today. That kind of introduction, we feel like we're giving ourselves a pass. We're kind of setting that expectation. And it might take me a little longer to do things because I got to find my way around. I got to figure out how things, the vibe on this unit. But what it really does is it lowers the patient's perception of care, not just with us. They're like, oh, great, I've got the newbie. I'm how is this day going to go? It's not just that, it decreases their perception of their care overall. So no matter what, even if I'm new, even if I'm struggling, even if I'm nervous, I don't need to say that. I just need to say, I'm here to take great care of you today. And that's going to start building that overall confidence and positive relationship that we're just going to continue to build on throughout the day. And so with that, I've developed a great relationship with my patient. We've gotten along great throughout my entire shift, and now I'm getting ready to go home. And I've got my colleague coming in behind me to take on the next shift. And so another way that I can manage up is to manage up through that introduction. So today, to say, or in this example, I've been with this patient overnight. I'm getting ready to leave. Good morning. Before I leave, I want to let you know that I've got my coworker, Ashley. She's coming in. She's going to be your nurse throughout the day. She is fantastic. She's going to take great care of you. And her patients love her. You're just going to she's so wonderful. So it's really just about introducing the next person that's coming in and building that trust because they trust me. And so with that trust, I'm going to then build that up for the next person coming in behind me. And this is important, not just for the patient's perception of their care and building a relationship with our colleagues, but it's also about the family members, right? So if I'm there supporting my mom, let's say, who's a patient, and I've been with her all night, I'm exhausted, and I really want to make sure that I can go home and see my kids and take a shower and get cleaned up. But whether or not I feel like I'm able to do that, a lot of time depends on how much I trust the care team that's here. And so having those introductions, it starts to, again, build those those foundations and those levels of trust to where the patients and family feel like they truly can allow us to care for their loved ones so that they can take care of themselves. And then we can also do this for managing up with other departments. So if a patient's having a procedure, if they're getting ready to have surgery, we're going to see that in their chart, and we can start to manage up those things as well. To say, I know you're getting ready to have an endoscopy tomorrow. What do you know about that process? How are you feeling about it? I just want to let you know that team's amazing. If I was having this procedure done, that's who I would want taking care of me. So you're in really good hands. Just those little nuggets that we can kind of sprinkle in throughout our conversations with patients. And for some of us, we tend to do this naturally if we're just positive people and we're just kind of trying to help our patients with their anxiety levels. But just want to highlight that it is something that we can do intentionally as well. And we can start to work to integrate that into those conversations so that it's a common piece in what we do. So individualized patient care, this is one of the things that we talked about in our definition of patient experience. And so when we're talking about that, it's really about the process of looking at that patient as an individual and identifying their needs, identifying that patient's priorities, and making sure that we're bringing that into the care that we're providing for them. And so some of these benefits, it helps to build that experience. It reduces that feeling of just being a robot. Like when we're coming in and we're doing all of our safety checks, we're doing our safety bundles, we're completing all the things that we need to do in our rounds. Our patients can tend to feel like when we're going through the motions, but when we're talking to them as an individual, it creates that connection. And so a couple of the ways that we can do that, one is just getting to know the patient and the family, having those conversations. And then through that, we can start to anticipate their needs and then advocate for them. So these kind of build upon each other. And so, you know, we say a lot of this is common sense. It's just not common practice. And I'm sure that so many of you do this automatically. This is just a way that you communicate in general. But for those of us that may struggle a little bit more with that, I'm one of those people. I'm not very good at small talk. It's difficult for me to like build those connections. So thinking about what does this look like in practice? So getting to know that patient or family member, trying to ask them some questions about what they like to do. What does a typical day look like for them when they're home? Starting to understand their life a little bit. And then when we learn some things that we can connect to, kind of sharing those appropriately as well. I mean, one for me, a way that I can usually connect with a patient is through sports. I'm a big sports fan. And so whenever it comes to talking to patients about what teams do they follow? What sports do they like? Usually I'm able to find some commonality there where it's not too personal for me to share, and we can find a way to connect. So that's just one example. Maybe you have like a similar hobby or you like the same TV show, those kinds of things really help to build that connection and get to know them. And then through that, we're going to learn even more. We're going to be able to take that a step further, things that they're comfortable with, things that they might need some more assistance with. Looking for cues in those conversations about what they might need as far as their experience goes, about just their likes and dislikes, what kinds of things they like to eat and drink, and ways that we might be able to help facilitate that. And then use those things as we're advocating for patients and families in other conversations. So when we're talking with dietary, or when we're talking with a physician, we're talking about ways that we might be able to support that family down the road, we are going to be the ones that carry all of that knowledge. And then we have the opportunity to be able to carry that forward with the rest of the team, because we're going to be spending more time with that patient through all of those rounds, through all of those interactions. We get to pick up on these bits and pieces that we can then utilize for the patient's best interests moving forward. Okay, so now we're looking at ADET, which is really like the gold standard when it comes to communication in healthcare. And it's broken down into 5 pieces. And when we talk about ADET, I think sometimes it can seem overwhelming. It can seem like there's a lot of pieces because like with managing up and individualized patient care, it's kind of a more broad and general concept that we're going to build bits and pieces over time. And ADET is very much, have you done these 5 things when you've had those conversations with patients and families? A lot of us tend to do most of these things naturally. But for some of us, again, if it's not commonplace, we want to make sure that we're working and putting in that effort to make sure that we're hitting each and every one of these pieces, really in every patient interaction. And it might seem like with 5 components that it would take oh, I'm going to be in there forever. I'm going to have this big long conversation. Not really. Whenever we have done some of these ADET examples with our own nursing teams, we were creating videos about a year ago to demonstrate components of ADET in several different patient scenarios. And the average amount of time that it took to make sure each and every one of these pieces was present was about 90 seconds. So it can happen quickly. So let's get started moving through what this looks like. So A is acknowledge. This a lot of times doesn't even necessarily need to be done verbally, but also it's just simply saying hello, knocking on the door, pausing before we enter, making eye contact, smiling, just recognizing that there's people in the room instead of just coming straight in and going straight to my tasks. So we're going to acknowledge, we're going to introduce. We just talked about that with managing up ways that we can introduce ourselves, telling them what my name is, what department I am, what my role is. So on average, our patients are going to interact with 75 to 80 employees in an average 3 to 5 day inpatient stay. It's a lot of people. So even though we are really comfortable and confident in knowing who our patients are, they might have a harder time differentiating us between all of the folks that they've got coming in and out of their room constantly. And they might, they might be on pain medication. They might not be able to think as clearly as they normally would. So they can't quite place us as easily. So we want to make sure we're just giving them that when we come into the room. Hey, it's Sarah, you're a nurse. I'm just coming in to check on you. Hi, it's Sarah. Remember, I'm your nurse. I'm coming to bring you your medication. Just making sure that we are giving them our name every single time until we get to the point where they greet us by our names without us having to share that. So if I walk in and my patient's like, oh, hey, Sarah, then I'm good. But for the most part, we're going to need to make sure we're reminding them. We don't have to do the big formal introduction. I'm going to be your nurse. I've been a nurse for 15 years. I love what I do and I'm here to take great care of you. We don't have to do that every time. But just kind of giving them that plug. Hey, it's Sarah, your nurse, every time we walk in. Duration. So we want to make sure that we're setting reasonable expectations for time. And that could be the amount of time that I'm going to be in with the patient. That could be how long it's going to be before they're able to eat it or drink again, or until their physician's able to come and answer some questions that they have, or before their lab results are going to be coming in. So we want to make sure really duration is about being as specific as possible. This is really, really hard in healthcare because so often we don't know how long something's going to take, right? If there's a delay in a patient going back for surgery, they're MPO and they are frustrated because they're thirsty and they're hungry and they're asking us, when is this going to happen? And I'm saying, I don't know. We had an emergency situation come in and it's taken over the OR and I'm not sure how much longer it's going to be. So what we can do and what we can control in those instances is when I'm going to update the patient. So I can come back and say, I know this is really frustrating and I apologize for the delay. I will make sure to update you on where we're at with this in 30 minutes. When I come back from my rounds again in an hour, I'll make sure that I have an update for you. So instead of saying, I don't know, or we're not sure, and leaving it at that, I'm going to give them something where they are going to know that there's at least an update. And a lot of times that's really all our patients want anyway. They just want to make sure that we're not forgetting about them and making sure that we're staying on top of it. Because most of the time when we're communicating well with our patients, essentially through this framework, they're going to be very understanding. So duration, explanation, And this is kind of what we've been talking about all along through that communication piece. We want to make sure that we're talking our way through the steps. Everything that we're doing from the moment we enter that patient's room, we're telling them what that is and we're explaining it so that there are no questions from our patients as far as what is going on in here. You know, a lot of times patients will tell me, well, my nurse, she just was really busy. She came in and ran around and would leave. But they didn't really know exactly what was going on. So if I'm checking on a piece of equipment, if I'm sanitizing a port before I'm giving medication, every step of what I do, I'm going to talk my way through it. So the patient is going along with me in the journey. And that's part of that that definition that we talked about, where we're partnering with them, we're empowering them, we're keeping them informed, and then they understand what's going on. And so last but not least, we want to make sure we're thanking the patient, the family member. Thanks for letting me take care of you today. Thanks so much for your patience. Thanks for asking me some questions today. I mean, whatever it is, whenever we're thanking them, we are giving them that sense of autonomy, and it shows respect. And that's a really important piece for our patients to feel valued, feel like actual individuals. And then it's also about creating an end to the encounter. And so I've got some additional tips that I'm going to share with you all. And I'm going to start with the bottom this time. But so not just saying thank you, but what else can I do for you before I leave? What else can I get for you? So it's kind of letting them know, okay, we're getting ready to end this encounter. My nurse is getting ready to leave the room. And so I want to make sure I'm getting anything I need, getting my questions answered, taking advantage of that time. Let's see. So with explanation, another tip for that, I think one of the biggest ones, we confirm date of birth how many times throughout the day in interacting with our patients. So many times. And our patients might be asking, why in the world do you have to confirm my date of birth? Don't you know it by now? Don't you have it memorized? You've asked me like 10 times. So let them know that it's a safety check and it's something that we do to make sure that that we have the right medication, or that we are entering it into the system correctly. Not necessarily like, I got to make sure I have the right patient. They're like, well, don't you know me? We want to make sure that we're explaining it in a way that's going to build confidence, right? Not create more questions. So with duration, we talked about the being able to give updates, but also making sure that we're just avoiding generalities. We want to avoid words like soon or a while, or in a little bit, or I'll be back to check on you in just a second. Those, when we say in a second, we literally don't mean a second, right? We mean more like, I'll be back in 2 minutes, or I'll be back in 8 minutes, or whenever we can be specific, we need to do it, because there is so little that our patients can rely on. And so we want to be able to give them those assurances whenever we can. And I think I went through that acknowledge and introduce piece pretty thoroughly. One of those things, yes, with acknowledge, we want to make sure we're asking that patient's preferred name with that first encounter, and making note of that. And then also just making sure that we are aware of everyone who's in that room. We want to make sure we know who's there, and that the patient is comfortable with us having conversations in front of those folks. We've had issues with that before, where staff go into the room to ask the patient specific questions, and they assume that whoever is in there, the patient's okay with having those conversations in front of them. Not always. So with that acknowledge piece, saying, oh, we've got somebody new in here today. Who do we have visiting, or who do we have here taking care of you today too? Who's part of this team? And then the patient can let you know, and then you can have that conversation before you move forward with the rest of that interaction. So something that I want to do at this point is take ADA and show you how that looks within the context of hourly rounding, because I think that's probably one of the more common interactions that you're having with your patients. You're doing this regularly at UK Healthcare. This is standard expectation that we round hourly on our patients during the day, every 2 hours overnight. And so how can we make sure that we're implementing ADET within those rounds? And I know that You receive a lot of what you're seeing today is probably review, and especially with the rounding piece, but wanting to see how ADET happens, how it can just be a part of your normal workflow. It doesn't have to be something extra that you have to work to include. It can just be part of what you do naturally. And so hourly rounding is really, really important. It is a standard best practice in nursing care, and it reduces unnecessary call outs. It really helps our non-urgent call outs. It really helps us with our workflow to make sure that we're not getting pulled back into rooms unnecessarily. We're able to handle things all at once. And then it reduces those quality and safety risks like falls and pressure ulcers as well. So just some basic steps to hourly rounding. And I know that there can be a lot more included, but these are the basic things that we know we try to hit on every time. And I've plugged in some of those ADET pieces so that we can see what that looks like. So of course, we're coming into the room, the A and the I, we're going to acknowledge, we're going to introduce. Hey, it's Sarah, your nurse, here to just do my hourly rounds with you. Making sure we're recognizing everyone who's there. As I'm doing each task, especially those standard safety checks that I do every time, make sure I talk my way through it. Make sure I'm explaining every piece of that safety bundle, and it's to prevent an infection. And this is part of what we do to link that quality and safe care together for our patients. We're going to make sure we're checking about pain, position, potty. We're going to explain how movement can help with with pain management, that we're going to reduce the risk of them getting that pressure ulcer by making sure that we're rotating their positions regularly. If they need any supplies for toileting, especially when we're in, dealing with pediatric patients, or we've got like a bedside commode situation, we're taking care of all of those things when we're in the room. And if we need to be providing assistance to the restroom, just going ahead and offering that and encouraging that when we're there on our schedule, right? And if the patient doesn't need that assistance at that time, then that's fine, but we just want to make sure we're offering that. We're making sure that we're looking at the environment, at the comfort level overall in the room. So this is where we just get familiar with the space and we start to recognize and anticipate those needs. So if that room tends to be cold, making sure that we've got those warm blankets circulating through in there, or sometimes the opposite. I feel like this time of year, it's the opposite. Rooms tend to get pretty warm. So what can we do to help our patients feel more comfortable? Can we get them more ice chips? Can we get them like a cool washcloth that they can use to help kind of reduce that feeling of heat or discomfort? Can we shut the blinds in that room to keep the sun from glaring in at certain points of the day? These things that we just tend to know, being more familiar with the environment that we can offer for patients. Making sure that everything is within reach. I've seen so many times when I go into a patient room where the tray's been moved out of the way so that somebody could access the patient a little bit better. And we want to make sure we remember to move it back so that they can reach their phone charger, that they can that their remote is accessible, where the call light is, those kinds of things. And again, all of this seems like common sense, but it's sometimes we get so in our routine that we forget to think about all these little checkpoints that to our patients, then once we've left, they're like, well, now I can't reach my drink, or now I'm not able to grab my phone. So we want to make sure, and then they have to push the call light so we can come back. So we just want to make sure we're addressing all of these while we're already in the room. And then as we're closing that encounter, explaining when we're going to be back, this is an example too of how with ADET, it doesn't always have to be in order. We can, as long as each component is present, we can, then we're hitting that best practice, and we're meeting that, we're fulfilling that. So with duration, and even with introduction, that could be something that happens at the end of the encounter. And with introduction, again, we're reminding them who we are. So to say, just a reminder, I'm Sarah, I'll be back in an hour to check on you, but if you need anything, make sure you press that call button and I'll come back in. So I've hit duration and I've hit introduction right there at the end as I'm closing out that encounter and thanking them for their time and their patience and cooperation as I've cared for them. So hopefully all of these components are things that you're familiar with, things that you are already implementing with all of your patients. But just as a refresher, again, when we're utilizing ADIT, when we're implementing it every single patient, every encounter, every time, that's when we tend to see some of those changes in our patient experience scores. And that's what can move the needle that we want to see, both for our improvement across the board in our enterprise, just and at the unit level with that communication with nursing. So thank you so much for your time, your attention today. If you have any questions at all, again, please feel free to reach out to me. I'm here to support you, as are all of my colleagues in the Office of Patient Experience. And we're just so grateful to have you here. And thank you so much for all that you do.